The baby weighed 800 grams, barely 2 pounds. Born 3 months premature, lungs underdeveloped, skin translucent, body temperature regulation non-existent. In 1978, Bogotá, Colombia, this baby needed an incubator to survive. But there were no incubators available. The hospital's neonatal unit had 12 incubators. There were 40 premature babies. Every infant who didn't get an incubator died within 24 hours. This baby had maybe 6 hours left. Standard medical practice offered nothing. And then Dr. Edgar Rey had an idea that sounded insane. Give the baby to the mother. Let her hold it against her bare chest, continuously, for weeks if necessary. He was told it would never work. The baby would die from infection, temperature, instability, lack of medical monitoring. But the baby was dying anyway. What did they have to lose? Before we continue, your like and subscription are essential. They tell YouTube that stories about mothers and medical innovation matter. Thank you. Bogotá, 1978. Colombia is experiencing a healthcare crisis. The city's hospitals are overwhelmed with premature births. Poverty, malnutrition, and inadequate prenatal care mean that premature delivery rates are catastrophically high. The Instituto Materno-Infantil, the main maternity hospital, is admitting dozens of premature babies every week. They have 12 incubators. Babies who don't get an incubator die. It's that simple. The mortality rate for premature infants without incubators is nearly 100%. Families watch their newborns die hours after birth because there's no equipment available. Doctors and nurses are helpless. They know what these babies need. Temperature-controlled environments, humidity regulation, oxygen support. But they can't provide it. There's no money for more incubators. There's no space in wealthier hospitals. These babies are dying for lack of resources. And then, Dr. Edgar Rey starts thinking about kangaroos. Kangaroos are marsupials. Their babies are born extraordinarily premature, essentially embryonic. A newborn kangaroo weighs less than a gram and is about the size of a jelly bean. It's blind, hairless, with underdeveloped organs. By every measure, it should die immediately. But it doesn't, because the mother kangaroo places it in her pouch, holds it against her skin, and keeps it warm continuously for months. The joey doesn't need an external incubator. The mother's body is the incubator. Rey wonders, could human mothers do the same? It sounds ridiculous. Human babies aren't marsupials. But these babies are dying, and mothers' bodies do regulate temperature. They do produce warmth. What if continuous skin-to-skin contact could substitute for an incubator? Rey teams up with neonatologist Héctor Martínez. Together they develop a protocol. Take a premature baby, medically stable but needing temperature support. Place the baby naked against the mother's bare chest. Secure it with a wrap. The baby stays there continuously, 24 hours a day. The mother becomes the incubator. Other medical staff think it's insane. They predict infection, hypothermia, death. But Rey and Martinez can't ignore the data from the babies dying in hallways. They need to try something. They present the idea to desperate mothers whose babies won't get incubators. Your baby will probably die without intervention. We have an experimental method. It's never been tested, but it might work. The mothers agree. What else can they do? If you're finding value here, please like and subscribe. Your support helps us continue rescuing these stories. Thank you. The first mother places her premature baby against her chest. The baby is cold, lethargic, barely responsive. Within an hour, the baby's body temperature begins to rise. Within 3 hours, it's stable at 37 degrees Celsius, normal human temperature. The baby's heart rate steadies. Oxygen saturation improves. The baby begins to root, searching instinctively for the breast. The mother begins breastfeeding. The baby, who was dying hours ago, is now feeding. Medical staff are stunned. They expected failure. They're witnessing success. More mothers try it. More babies stabilize. Within weeks, it's clear. Kangaroo Mother Care works. Not just marginally, spectacularly. Babies held skin to skin have better temperature regulation than babies in incubators. They have fewer infections because the mother's skin transfers beneficial bacteria that protect the baby. They breastfeed more successfully. They gain weight faster. They cry less. They're calmer, more stable, healthier. And the mothers? They're bonding with their babies in ways that incubators never allowed. Over the next year, Rey and Martinez's team uses Kangaroo Mother Care on 300 premature babies who would have died without incubators. The survival rate is astonishing. Over 70% survive. Before Kangaroo Care, babies without incubators had a survival rate near 0. This simple intervention, holding a baby against your chest, is saving hundreds of lives. And it costs nothing. No expensive equipment, no specialized training, just a mother, a baby, and continuous contact. It's revolutionary, and the medical establishment hates it. Western neonatologists dismiss Kangaroo Care as unscientific. They say it's dangerous, that it lacks proper monitoring, that it's only working because Colombian babies are somehow different. They refuse to adopt it. For years, Kangaroo Care is practiced almost exclusively in developing countries where resources are scarce. Wealthier nations continue relying on incubators, dismissing the Colombian innovation as primitive. But then research begins emerging. Study after study confirms what Rey and Martinez observed. Kangaroo Care isn't just as good as incubators for stable premature babies. It's better. Babies held skin to skin have improved cardiovascular stability, better brain development, reduced stress hormones, stronger immune systems. The World Health Organization endorses it in 2003. UNICEF recommends it. Major medical journals publish meta-analyses showing Kangaroo Care reduces premature infant mortality by 40%. Today, Kangaroo Mother Care is standard practice in NICUs worldwide. Even in hospitals with abundant incubators, stable premature babies are placed skin to skin with parents as much as possible. It's called Kangaroo Care in English, Método Canguro in Spanish, and it's saved millions of lives. Parents who practice it report feeling more connected to their babies, less helpless, more empowered. Babies benefit in ways we're still discovering. Recent research suggests Kangaroo Care improves long-term cognitive outcomes and reduces developmental delays, all from something as simple as holding your baby. Dr. Edgar Rey died in 2016. He spent his final decades promoting Kangaroo Care globally, training healthcare workers, advocating for parents' right to hold their babies. He never sought patents or profit. He just wanted babies to live. And because of his willingness to think like a kangaroo, when conventional medicine failed, millions of premature infants have survived who otherwise wouldn't have. Every parent who has held a premature baby skin to skin, every NICU that practices Kangaroo Care, every life saved by the simplest medical intervention imaginable, they owe a debt to a Colombian doctor who refused to accept that babies should die for lack of incubators. Sometimes the most advanced medicine is also the oldest, a mother holding her child. If this story moved you, your like and subscription make a real difference. They help us continue telling stories of innovation the world almost missed. Thank you for being here.